We moved to a place in the healthcare industry where 5% of the patients occupy fully 50% of the resources, and there's all sorts of related statistics around the shortcomings of the healthcare industry. Both of you guys are taking advantage of artificial intelligence in various ways in your businesses, and artificial intelligence generally is really coming into the healthcare industry in a big way. Hank, how is it going to help you bring a better product?
We're using it with simple point of care tests to be able to see positive tests below the limit of human eye detection and transmit that data to clinical providers that are board certified in the states where they're seeing patients to let people know when patients have the flu, when maybe on site in a real office that would be misdiagnosed. As we progress and as regulatory environment allows us to, we'll allow patients to initiate some of the process of diagnosis for simple conditions.
And Andrew, where do you see it going?
The area of focus for us is a little bit different. We look at longitudinal health histories from patients. So looking at every piece of data that is ever tracked about you as an individual. That's the claims data that your insurance company sees, the electronic medical records that your doctor sees, maybe even those surveys that you fill out when you go to the doctor's office. Trying to take all of that historical text data and predict future health outcomes. And so the questions are things like, who's most likely to be expensive? Who's most likely to be admitted to the hospital? And the way that gets used is that providers have programs that are really targeted towards that top 5% that you talked about. Who are the people who are most likely to need our help proactively? And so for us, it's all about using that historical patient data to predict who's going to be in that top 5% before they get there, because that's the biggest opportunity for savings in the industry.
When you talk about the data that's out there about patients, it's often, the term messy is often used to describe what's out there. That's got to be a challenge for both of you guys. How do you overcome it?
You know, so it's not just that it's messy, it's fractured. You may go see your primary care doctor and they've got a subset of your data, but another time you're sick and you go see a specialist or you go to an emergency room, and the interoperability between these systems isn't always great. And so part of our solution too is extracting the data from different platforms to make sure that we have your health data aggregated in a single place so that we can do what Closed Loop is doing, where if we know that you're on a certain medication, that we're not prescribing something that's contraindicated. So those types of safeguards can be built into a platform that uses algorithms that you wouldn't get in a traditional setting.
And where have you seen it go the wrong way with messy data?
When you kind of own the full workflow, you can really work on perfecting the data that you have, and you can gather kind of all these different data points. But that's just not a reality for a lot of the stakeholders kind of in the industry today. So if you look at payers, they don't have the full electronic medical records information, and the providers aren't necessarily going to share it with them. The challenge is not for us, how do we kind of get all of the data in one place, but rather, how do we make the best use of the data that you do have? And so this idea of messy data kind of being a challenge that you have to solve before you can benefit from machine learning, we have a term for that. We call it data shaming, right? And this idea that somehow your data isn't good enough. I promise you that there's enough predictive signal in the data that you already have.
With all of this considered, what do you think is the near-term ROI that the insurance industry and the healthcare practitioners, what are they going to see near term with AI?
A lot of times we're working in a context that's called population health. And so the question is, how are we trying to find those top 5% that we think we can impact with some type of proactive intervention? So that might be something like enrolling someone in a care management program where a nurse reaches out to them and talks to them about taking their meds or getting to follow-up appointments. These people who have, a variety of different comorbid conditions where they're really sick and they need help and guidance. If we can get the right people to the top of the list who are really going to have these challenges, then that means those interventions that we can't afford to give to everyone get applied to the right people.
The ROI should really be, what's the ROI on outcomes? I mean, what is really happening at home with the patient? Right now, there are 550 million visits for the top 5 reasons that people seek healthcare for unscheduled visits. So not your annual well visit, but I'm sick this morning, I've got a sore throat, my daughter has pink eye. And so if you can tackle those issues in a more cost-effective manner, and you can keep people out of urgent cares, emergency rooms, and put them on a solution that allows them to do it for a fraction of the price, for less than a copay, you don't need to worry about what's the ROI for the payer.